Hey, everybody. So good to see you. It is Kevin and Lauren from RPH Ally and the Functional Medicine Pharmacists Alliance. And we're super excited for the first true episode of the Functional Medicine Show. I want Lauren to introduce herself and talk all about the incredible things that she's doing and introduce us to functional medicine. The reason you guys should stay tuned is if you haven't encountered functional medicine, which I feel like many of you have, here's a really good first step into understanding it and to getting in some details of how you can become, a more robust clinician with these skills. We'll talk to you in just a sec. Lauren, so excited. Like when I woke up today, I was like, finally, Lauren's show. This one is going to be so much fun. Please, once again, introduce yourself to everybody that might not know you for the intro, and then let's jump into it.
Absolutely. Hi, everyone. My name is Dr. Lauren Castle. I am the founder and CEO of the Functional Medicine Pharmacists Alliance. We are a group that's been around since 2017, really starting to provide resources for pharmacists in the functional medicine space. A little bit of my background, whenever I discovered functional medicine, it was really through our health challenges that my husband and I were experiencing and not finding solutions or answers to in the conventional medical system. So for a lot of you, I hear that that is a common scenario, right? That you have your own issues, that maybe you're starting to explore other pathways to health and healing. And functional medicine really has come such a long way in the last 7-8 years that now it's becoming more mainstream, right? And so at the time back then, there was really only a small number of us, around 30 of us or so in a Facebook group that were exploring these modalities and trying to learn from each other around what was the role of pharmacists in a functional medicine care team. Now there's over 3,000 pharmacists that are in that group and in this space, and the number's growing every day. So that's why we're so excited to partner with RPH Ally to bring even more pharmacists into this functional medicine space, because unlike there being a quote unquote shortage of pharmacists, which we know is not the case, there really is a shortage of functional medicine practitioners. And so it's such a perfect opportunity for pharmacists to become educated in this space and be able to provide real solutions for your patients.
Amazing. Yeah, I think that the growth there, Lauren, really is, it speaks to itself. Going from 30 to 3,000 is incredible. And knowing so many of our colleagues like we do, I know that you and I are going to Healers in Healthcare here coming really soon. And there's a big buzz behind that. Everybody's joining. This is the last day, Lauren, that someone can get buy one, get one free. So if you guys are coming to join us May 5th through 7th in Cincinnati, then let's do it. But I think with that, like there's been such a move for us to all look at allopathic medicine and realize there's some gaps and there's some things that we're just not servicing our patients as well. And tell us some more about, I guess, your journey there, Lauren, on where those gaps kind of started for you and how you realized that there has to be a better way to do medicine.
Absolutely. So, I think there's so many chronic conditions that we're aware that lifestyle medicine can make a transformational difference for patients. And so, what I find is that functional medicine, it is lifestyle medicine. Like that is the foundation of it. And just to kind of even back up for a second, for those of you who might be new to functional medicine and hear this word thrown around a lot, but maybe you're not sure, okay, how do you actually define it? What's a proper definition? So it's really defined as a systems biology-based approach that focuses on identifying and addressing the root causes of disease. So you'll hear that a lot, root cause approach to disease, right? And so that makes sense. And one way that we like to think about that is that, sometimes you can have symptoms or different diagnoses that are just one factor contributing to disease. But then on the other hand, you can really have a single diagnosis that has lots of root causes. So I think Kevin actually had a graphic that we were going to show to kind of illustrate this a little bit. But this is a great example, right? So let's say you have a patient come to your pharmacy and they're picking up an antidepressant for their depression. The antidepressant is one treatment option that can absolutely make a life-changing difference for patients who are struggling with mental health. But there are many underlying causes of depression. And we know this, like we learn this in pharmacy school, right? That there is more to it than just the chemical imbalance theory. That has sort of been debunked in terms of being the only thing that contributes to depression. So, this biopsychosocial and spiritual model of depression is a more accurate depiction that explains why you might have some patients who respond to antidepressants and others that maybe don't. We also know that there's things like pharmacogenomics in there that can make a difference. But if you actually look at the DSM and you really read in there, there's so much that goes into making the diagnosis of depression around ruling out other conditions. And so that's what that graphic was sort of illustrating, that you have to screen for things like their thyroid health, right? If a patient has low thyroid hormone, they can have depression symptoms. If they have low omega-3 levels or other nutrient depletions, folate is especially prevalent. You can have depression symptoms, right? That's where, if you think about your medical foods like the Fultix that you probably have in your pharmacy, that is a medical food for depression because people who are low in those folate levels can have those symptoms. So that's one way to think about how we can approach one chronic condition through a functional medicine lens with all these different contributing factors. But on the flip side of it, what's different and where we really start to see the more conventional model not working so well is that healthcare has become very fragmented. We have all these different specialties, right? So you might have one patient, that same patient coming in with their medication for depression, and they have all of these other health conditions. So maybe they have heart disease, diabetes, they have, gout, they've got all these other conditions, which certainly would contribute to that depression as well. But what if, instead of having to send that patient to all these different specialists who are going to prescribe all these different drugs and then have to follow all these different plans, we figured out the root cause of the conditions? And that's where we really start to see that most patients only have a couple of root causes and that they're all tied in together. For a lot of patients, that looks like inflammation. So that can be a key driver of all these different chronic disease states, like heart disease or arthritis or even cancer. They can all have this inflammatory subtype to them. And we can treat that one root cause through lifestyle changes that are going to make a difference for all the different conditions. So this is what we're talking about when we use this functional medicine approach. And what's really exciting is that for pharmacists, you can start to layer in this approach to whatever practice setting you're in, whether you're in the community setting, whether you're in a hospital setting, whether you're in ambulatory care or primary care, if you're in long-term care or working with geriatric patients. This functional medicine lens is just the way through which you're going to start seeing your patients and seeing that interconnectedness, and then being able to suggest other lifestyle treatments that potentially can really ameliorate all the different symptoms, all the different conditions, while still using pharmaceuticals, right? Because for a lot of patients, they're really deep into their disease state process. And so while we love the food as medicine approach, and it can be so impactful and really create dramatic differences for patients within a matter of weeks, we also know that not every patient is going to jump all in and make the changes that we want to see happen. And so it's so important for pharmacists to be able to walk that line of using medications safely, being able to adjust doses as we see improvements, and then also being a resource and understanding the different lifestyle changes that we can make, supplements that we can potentially add in for more rapid relief, and of course, referring and working with all the different modalities and partners and physicians and other types of practitioners that we use in a functional medicine healthcare team approach.
I think that's fantastic, Lauren. You touched on the two sides of that kind of graphic so well, with depression having so many like causative outside components. Quick one, I guess, is so I had some shoulder problems a little while back. It was all of a sudden I felt like I was losing strength in my left arm. So going in and seeing the physician, I was thinking, okay, I must have slept on it. Maybe I've got a chiropractic thing going on. What's the case going to be? And everyone from the orthopedic surgeon that I talked to that said, Kevin, let me see your arm, would move my arm around and see that I still had remaining strength. Said, no, there's nothing really wrong. It's just something you must have done. It'll just go away over time. And then the next one, primary care physician that worked with a physical therapist, said, well, here's the exercises you should do to get rid of it. I said, but what was it from? Like, how do I avoid that from happening again? She's like, I'm not sure like what went on there. So after seeing all of these individuals and talking to all these different folks, it had to go back to me trying to do the puzzle of what did you do? Like, what are you doing differently? How are you going about life in a different way to be able to, avoid this happening again? Because for so many of us, Lauren, that is a frustrating element to healthcare is go in, get fixed, go back again, get fixed again. And you're never really getting better. You're not avoiding those kinds of issues over time. So I think with functional medicine, looking at what is the root cause of this and avoiding that constant cycle, that for me, I can see how that is part of depression, of someone feeling like they do not have control of their own bodies and don't realize how to take care of themselves in order to get rid of that vicious cycle that they're seeing someone. Because you and I love our patients, right? But they don't love seeing us talking about the same thing over and over again and not getting better and not seeing results. And sometimes I feel like we feel handcuffed to only having a few options. Here's what I can give you. Here's what's prescribed, and I'm hoping it'll work for you. But seeing this holistic picture and being able to make a difference, I think from a long-term benefit standpoint, a multi-generational benefit standpoint, it's really inspiring for me as a pharmacist that cares so much about cultural identities and making sure relationships are well formatted. For you, has that changed your career, Lauren, about the way that you approach, patient engagement?
Absolutely. For me, I started using functional medicine all the way back in 2015, 2016, again, through my own health issues. But as I started to really see the benefits, then it was so much easier to talk to patients about it. And actually, in 2016, I was working in Flint, Michigan at the time during the water crisis. And we had a phenomenal opportunity because there were so many patients coming to us with high lead levels in their water. And again, like, what a horrible thing to happen. But I felt so blessed to be having this knowledge and this awareness that there were things we could do to help mitigate those potential effects of heavy metals. And that's something that we talk about in a functional medicine approach, that, for a lot of patients, we have these lifestyle factors around stress, sleep, food, movement, connection, community, right? But for a subset of patients, what we find is that even when you are doing all of those things right, and this was our case, right? We thought we were doing all of the things right in terms of like living a very healthy lifestyle, a very active lifestyle, eating fresh foods. We still didn't feel great. My husband still had health issues. I didn't even realize that I didn't have the optimal energy that I could have until we realized that we had things like gluten and dairy sensitivities. And so that was a more esoteric, sort of out there kind of thing that we wouldn't have discovered in a regular lens. Same thing goes for things like heavy metal toxicity. That's not something that we routinely screen every patient for, right? But certainly if you've been exposed to something like that, or perhaps, I see it very commonly with patients who are struggling to lose weight, but they're doing all the right things in terms of eating less, moving more, trying to eat fresh, trying to control their stress, trying to control their hormones. Sometimes it can be something like heavy metal toxicity that's under the surface that they don't know about, that actually causes them to have difficulty losing weight because it's the body's protective mechanism to keep those metals sequestered and out of circulation. And so that's sometimes where this functional medicine approach can really lead, is like very different ways of thinking about problems and discovering hidden root causes that you might not otherwise have figured out. So part of that comes from taking a more detailed health history. And again, depending on the type of setting you're in, am I going to be able to sit down for a whole hour and go through a timeline or a matrix, as we call it in functional medicine language? Not necessarily, But there are settings and there are ways of creating practices. And I think this is where the future of, more clinical pharmacy roles and leveraging pharmacists as providers is going to take us, where we are able to really spend more time in digging into those functional medicine questionnaires and things for patients. But certainly you can start today. You can start utilizing small, easy questions to ask, and again, just to use depression as an example, you can start screening patients for depression with just a 2-question symptom questionnaire.
Mhm.
And that can open up a whole conversation, right? So it's just ways to think about the patient's health in a more holistic lens, and then start to understand like what resources can you provide them to support the medication that they're taking, but also the lifestyle changes that they need to make.
Amazing. Yeah, I think that the tools, like that's a great way to end our first episode, is talking about the resources and tools that can take that 1 hour conversation and utilizing digital health platforms or other resources to be able to make that a very compacted solution for a patient to be able to leverage a functional medicine pharmacist in their practice, and hopefully also inspire pharmacists that you don't always have to have that hour per patient kind of feel, which a lot of us might think in our minds, like we're really going to dig deep, we need lots of time. And sometimes we can piecemeal that together and make some relationship components and some other minor modifications that Lauren and I will be able to talk about over weeks to come to be able to let you guys know how to do it. So Lauren, wonderful first episode. So excited to keep rolling with this with you. Thanks for the folks that tuned in and that are excited about functional medicine, because I know that we are. Lauren, any parting words?
I would just say, think about this week how you can start to approach your own patients in whatever practice setting you're in through that functional medicine lens.
Awesome. Awesome. We'll talk to you guys all soon. Have a great rest of the day.